So tell me something. See, I know getting these policies to get people to buy into them and to do all that, it's a very challenging endeavor, you know. So how see, I'm asking this because I'm sure I will have one or two people who are going through stakeholder management. So as a successful person in that, what are the things you do to get your stakeholders engaged in your endeavors?
Yeah, okay. Yeah, so in terms of the most important thing here is the community. And when people say community, not geographical communities, like in a
Yeah,
geographical sense, but you look at the communities of practice of different people in different fields.
yeah,
So there are always challenges, but
of
when you
course.
look at the community, so as what I would advise every expert out there is join a community, like join a professional association, and then make sure that the you become very active in it. So as an active person, look at what are those issues that affect in your profession that affect people.
Mm.
That's a good way to start. So I will usually give an example, like for example, teachers. So a teacher within their community, that they are seeing, they have the opportunity to interact with the local community where the
Yeah,
school is.
yeah.
Then, besides that, they're interacting with the parents and caregivers of their
People's.
pupils and students, and yet they belong to a community of practice. That's
Yeah,
the teachers, the thing. So, what are those issues around them that affects their pupils and their students,
yeah,
and that they can influence? Because definitely it's not everything that one can influence. Like
yeah,
I gave an example, like hand washing.
yeah,
Do their pupils have enough, space and resources to wash their hands and
yeah,
prevent infection among them? Now, once they're able to identify that problem and identify um, the root causes of the problem, so then what they do is to bring themselves together, and then they'll get to talk to the community leaders
yeah,
to say, okay, let's see how we can get a borehole open, or a well or something. And then they then get to talk to some of the parents of their children who are highly placed
yeah.
and are policy makers and have the power to make decisions. So just that way, you find out that they've been able to influence and save lives beyond their regular teaching practice.
Yeah. Wow.
So yeah, so that's one example I can give. So
Yeah.
in doing that, they can actually go as far as influencing the policy side of it, because that's how this conversation starts.
Yeah.
So they can say, oh, the water, then somebody says yes when we dig this well, but bear in mind that when we dig this well, when the dry season comes, the well will dry up.
Mm.
We need a more sustainable form of
Water supply.
and then when they say we need a more sustainable form of water supply, somebody will ask, who is likely to give it to us? And then somebody will then say, okay, let's talk to the local councillor. Then you go to the local councillor, and then you then begin to ask other broader questions. What are the capital projects that have been allocated to this community? And then who are the people who are making those decisions? And then you continue until you get that problem solved. It might not happen, yes. So it might not happen in one day,
Yeah.
but being able to come together, being able to make sure that decisions are made together is how you are able to identify the pathway to change. It could go as far as, leading them to whoever has the decision, the capacity to allocate water projects, that community. And so that's how policy reforms.
Yeah.
And then once you now make that, then the next question is, okay, how do we sustain the water supply? Apart from now that we have, let's say, the pipe-borne water, how do we get money to change the pipes when they break? How do we get that? So those and to be honest with you, these things used to happen way back. So in the past. So I remember, like, in my community, they had a development union.
Yeah.
And through the development unions, they were able to put the water pipes, and then they were able to think through, like, how are we going to sustain these pipes?
Yeah.
And then they now either understand if they feel that it's very cumbersome to get the policymakers, then they do it as a community and tax people until they change the pipes when they break. And those projects have continued. And I think so those are the things I observed as a young person that made me to get very, very, very interested in policy reforms. Even as a medical doctor. It's not when, as a medical doctor, what really led me to public health was coming to hospital and seeing people dying in numbers. So I graduated from University of Calabar. It was, you see different diseases, and you get people who couldn't even afford paracetamol. As a medical student, you would have to go to work with your bag stuffed with different denominations of money, so that if anybody asks, at least to the best of your ability, you're able to. And then I started asking,
out of pocket.
Out of pocket, how many
Funding patients
can I possibly buy? How many syringes? How much can we donate to get people have a next round of dialysis? So what can we do better that can save more people? And that was what led me to the work I do today, to import public health. And then